Okay, so the interesting thing about botulinum toxin, as many of us know, is Botox or anti-wrinkle, is it can be used for a multitude of different procedures. So if we start looking at the forehead, we know that it was found that you can get wrinkles on your forehead because the muscle attached to the skin. And if we inject botulinum toxin in there, then that can soften the movement, therefore softening the wrinkles. And we can use that also for the corrugator, the frown complex, and we can use it for the smile lines as well. Interestingly, it can also be used if the muscle of your chewing, which is the masseter, can get big. And that can be tension, it can be grinding, it can also be linked to the temple, which is tension, grinding, and clenching. And we can put Botox in the masseter, which is that muscle of clenching, and also the temple here, which you can feel when you clench as well. And that can soften that, reduce headaches, and also reduce the size of the masseter, which in women can be beautifying, and that's called jaw slimming. It can be also used for the neck if you get necklines, botulinum toxin in that area, and that can reduce necklines and smooth the neck area as well. And we also can use it for your armpits, and that's if you find yourself sweating. We know that it can affect the sweat glands, reducing sweat, and so that can be done maybe twice a year, and that can reduce the sweat if you find that's an issue. If you find a lot of tension in muscles, i.e. in your shoulders or your neck, and you're getting some spasm, you can inject botulinum toxin in there, and that can smooth and soften the muscles there as well. Finally, something I'm doing quite a lot now is the lip flip, where I do a trickle of Botox just above the lip. And what that does is, if you find when you smile or when you're talking, your red lip disappears, it just keeps that out there and it has a really nice finish.